Well, welcome everybody to our September September coffee chat. I can't believe that it's September already. We are recording and it will be added to the PFA Network website. So you are more than welcome to go back and watch and listen if you missed anything. We also add it to our PFA Network forum. So if you would like to add more to the discussion later on, you're more than welcome to head to the forums to add to the discussion. I also started live transcript. So if you need it, there is a CC at the menu at the bottom of your screen, and that'll turn on live transcript for you. These are our agreements for each and every meeting we put on. We practice active and empathetic listening and sharing. We want to challenge the idea, not the person. Be both teachers and learners. We want to take space and make space. Our stories stay and lessons leave. We want to make sure we use I statements. One person speaks at a time, and we want to be present and be here now. All right, we'll do our welcome question. I always love our check-in questions. So let us know your name, where you're calling in from, and if you could live anywhere else aside from where you're living now for just a year, where would it be? And I'm Laura Jackson. I'm calling in from Eugene, Oregon. And if I could live anywhere else besides here, besides California is my second home, I would live like in New York City. I'm a country girl at heart, but if I could just experience big city life for only a year, I don't think I could handle it any longer. I think that would be really cool. So I'll go ahead and get started with Dr. H. Is at the top of my list here.
Okay, just unmute it. Good morning, good afternoon, good morning, everybody. I'm located in central New Jersey, about 15 minutes from the ocean. And if I could live anywhere in the world, probably Mallorca, Spain.
Oh, yeah, that's a good one. Thank you. Thanks for joining us. Tara?
Hi there. Hi. Can you hear me? I don't know if I put myself on.
Yes.
Am I on? Okay, good. So I'm Tara. I'm new to this, and I live in Warwick, Rhode Island. And I think if I could live anywhere just for a year, I would like to go out Midwest, West, Colorado, Montana-ish. I would just like to live in the mountains and breathe some fresh air for a year. And then I would come back to my little city life, I guess.
Nice. Well, thank you for joining us today.
Thank you. I'm glad to be here.
Belinda.
Good morning. My name is Belinda, and I'm here in Los Angeles, California. If I could live anywhere, I think I like to live in a country set.
Nice. Thank you. Thanks for joining us today.
Thank you for having me.
Kathy.
Good morning, everybody. I am Kathy Salazar. I am in Albuquerque, New Mexico. I love Albuquerque north into northern New Mexico. We have high desert and mountains, and it's just beautiful here. But if I could live anywhere else, there's a little town in Oahu that's called Haleiwa, and that would be my home for the rest of my life. I love it so much there.
I love Hawaii. Thank you. Dorothy.
Hello, I did put mine in the chat, but I will say that I am Dorothy Winningham. I'm living in Georgia now, and it's called Warner Robins, about 2.5 miles below Atlanta. And if I could live for 1 year in a place, it would be St. Louis, Missouri. We lived there for about a year, maybe 10 years ago, and I thoroughly enjoyed it. So I would love to go back there again. Thank you.
Great. Yeah, thank you. Lester.
Hi, I live in Southern California near Pasadena, right across the street from City of Hope, basically, where I received my bone marrow transplant 7 years ago. And if I could live anywhere, I think it probably would be one of the Hawaiian Islands. I'm not sure which, because there's so many good options, but just for a year, that would be wonderful to just get away and lay on the beach.
Absolutely. Yeah, I feel like any of the islands would be great.
Aloha spirit.
Yes. Thanks for joining us. Nancy.
Good morning. I'm coming in by phone call instead of Zoom, even though I got my software somewhat improved. I live in McIntosh, New Mexico, which is about an hour east of Albuquerque. And I've been with a group in the past, but had some technical problems for 2 or 3 weeks. And I think I would choose the state of North Carolina. I'm not quite sure of the place, although I might want it less than a year when hurricane season started.
Thank you. Thanks for joining us, even by phone. Rosemary?
Oh, hello, my name is Rosemary Walkup, and I am in Skagit Valley, Washington State. So it's an agricultural community nestled against the Puget Sound. Very beautiful with the mountains and the valleys and the water. But if I was going to live anywhere for a year, I have 8 children. They make fun of me all the time because anytime we go anywhere, they say, Mom always says she could live here. I would live in Port Stephens, Australia. And that's where my mother lives. And I love going over there. And I just have a really great community of people there. And that's, I think anywhere you go, it's all about the people.
Yes, absolutely. Thank you. Thanks for joining us today.
Thank you.
Let's see here. Lindsay?
Yeah, hi everyone. I'm Lindsay Galley, Director of Education at PSCC Partners, and I'm located in Sacramento, California. So I think if I could live anywhere for a year, it would be somewhere minutes away from water, whether Tahoe or, I'm with Lester with the Aloha Spirit, the Hawaiian Islands, just anywhere that's relatively close to a body of water.
Yes. Thank you, Lindsay. All right. And I think we just had Libby join us.
Good morning, everybody. Sorry to be late to the call.
Good morning. That's okay. We're just doing our check-in question, which is if you could live anywhere in the world for a year, where would it be?
Oh, I always wanted to live in New York City for a year, just to see what city life is like.
That's exactly.
Although I live in a city, so not sure.
Thank you. All right. And Rosie.
Hi, I'm Rosie and I live in Wisconsin, Rosie Bartell. And if I could live anywhere, I would live in Ireland, Galloway, Ireland, particularly. And definitely have been there twice and wish I could live, I think, 3 times. David and I were there 3 times and loved Galloway. I love the Galloway Athlone. Dublin was okay, but it was the small communities. And the person who said it was about the people, it definitely is the people. I mean, by the 3rd time we were there, people were inviting us to their homes, and that was great. It was great to get to know the people. So
I love that. Thank you, Rosie. Actually, if I could say, some of our very, very best friends just moved last month to Galway. So I'm glad to hear that the people are great.
Oh, they're great. They're
and
great.
We will, of course, be making many trips over there, I'm sure. All right. Did I miss anybody before we move on? I think I got everybody. All right. We'll go ahead and move on. And Rosie, I'll go ahead and keep it with you.
Okay. Well, this is Sepsis Awareness Month. And so I want to carry on a little discussion about sepsis awareness. The first thing I want to talk about is sepsis for a patient and the family and their care partners is very different than sepsis for healthcare professionals when there's a crisis. And I learned this by first having experienced myself, but I also met a mother who lost her daughter to sepsis at 23. And it was her daughter had gone to the emergency room 3 times on a weekend and was sent home 3 times because they thought she had the flu. And many of the sepsis symptoms start out kind of acting like flu symptoms. And 12 years ago, there wasn't the thoughts about sepsis in the same way we think about it today. And lots of people died of sepsis at that point. But basically she was healthy. And so they kept thinking she had the flu. And so they kept sending her home. And on Monday, she died of sepsis. And so that mother was literally meeting with Congress, and she was going the political route to get an awareness of sepsis. My route was that I decided I wanted to talk to other patients who were experiencing sepsis because I knew what sepsis was like for me. And so I started interviewing patients and family members and members of families where they lost someone to sepsis. And what I learned is that we all have very similar experiences. It usually starts out with you feeling like you have the flu, feeling fatigue, and then you start getting what I call fuzzy brain. Your brain is fuzzy. You can't get your words out. You can't think straight. You can't. You just can't relate well, and your family starts saying you're not making sense. And many times, at least for me, because I run a very low temperature, by the time I got to 98, I was pretty close to major sepsis. But sometimes that fact of you having slurred speech and those kind of things comes before the temperature. And once you start with a temperature, and they say at emergency rooms, they say at 101, if they come in with slurred speech, fuzziness, 101 temperature, they now treat you for sepsis because the protocol for treating for sepsis is better than not treating for it. So my protocol is 100 because when I get to between 99 and 100, I have what I call almost like out of body experiences because I will be in and out of consciousness. But when it's a state of being able to see myself if I'm sitting in a chair or if I'm in a doctor's office or if I'm in a hospital bed, I can see myself in the bed. I can see the people all around me, but I can't communicate with them. I can't get them to hear me. I can't get my words out to tell them that I'm very sick and I feel like I'm going to die. And when I started talking to patients, they all had this kind of experience. What happened was at the same time I was talking to healthcare professionals and I was asking them what they knew about their sepsis patients. And they said, well, they usually come in with a high temp and we treat them once we take blood work and we find out that they had a blood infection, which is sepsis, then we treat them. And I'm like, well, you were missing it. And I said, do you ask them what it's like for them? No, I've never asked them what it's like for them. And so I was collecting all this data and I started sharing it with healthcare professionals. And that data made them, I remember doctors saying to me, I never talked to anybody about this. I never asked the sepsis patient what it was like for them. But so they started asking and collecting the data. Remember, our patient stories are data. And if everybody's having the same experience when they have sepsis, that means there's a protocol that should go in place earlier than later. And basically giving fluids and giving a broad spectrum antibiotic is not going to hurt anybody in a short time while you get blood work, because that's what's saving lives today in emergency rooms, is that when people now come there and say, I can't seem to get my words out, I'm fuzzy brained, I'm running a temperature of 101. My protocol was 100. And, my doctor told told David, if she hits 100, call the ambulance, because you're not going to get her fast enough to the doctor, to the hospital. And, when did he come to this protocol? He came to that protocol when I was in his office. When I got to his office, he realized I had an infection and he was going to give me my first dose of IV antibiotics. And then he was going to send me with IV antibiotics home to administer myself. But while I was there getting that first dose of IV antibiotics, I started having this experience of, when I got to the doctor's office, my temperature was 98. So he thought that my temperature was normal. I had the start of an infection. Well, I went from 98 to 100 within a couple of seconds. I also started not being able to speak. And David said, she's going septic. And he goes, how do you know that? And he goes, because I've seen it before. And so basically, he's like, you know what? I'm calling an ambulance. And David said, the hospital's 2 blocks from here. He said, I don't care. I'm not letting you drive her over there. I'm calling an ambulance. And he literally walked me in the wheelchair to the ambulance, or followed the ambulance, because he said, I get the call and say, we've got somebody in the emergency room. We think they might be septic, or we've taken the blood work and they're septic. What do you want us to do? He said, I have never seen this. I have never seen what it's like. I don't understand this. He said, and it was like a awakening for him to realize that you can go from fuzzy brain to no temperature to being unconscious. And I mean, I've literally lost days of my life. I mean, sometimes I would, go into septic shock and wake up, one time it was 6 days later, intubated so basically sepsis can move that fast. And that's why we now have sepsis protocols, because that's why people died of sepsis. Because when they got to the hospital, or even when they were in the hospital and they started getting this serious infection, and there's community, and people can come in from the community with the infection, or there can be healthcare acquired infections. But eventually, somebody with cancer can die of sepsis. Someone with a heart condition can die with sepsis, because if people often with pneumonia, they will say they died of pneumonia. They really probably didn't die of pneumonia, they died of sepsis. Let's move on to the second question. Or does anybody have any questions at this point?
This is Dorothy. I don't have a question, but I'd just like to agree with what you just said, Rosie, and that is, I did a video with HQI having to deal with sepsis, and it was around that timeline that you were talking about it. And my brother, who had a kidney transplant at that time, had gone into the emergency room. What had happened is that he was, I don't know about the temperature, but he was having some of the same, yes, as you described. I mean, I met his wife at the emergency room, and as we were getting him out of the car, he was limp. He was just bent over. I mean, it was just awful. So they took him on into, got a room for him and everything. While he was there, again, he was experiencing some of those symptoms that you mentioned. And I said to the nurse, I said, I believe he's septic. And she looked at me as if I was crazy.
Yeah.
In the meantime, they were getting his blood work. And immediately, apparently, the blood work came through. She pushed us out of the room and said, he is. And they sent bells off. But now it's just like a heart attack or something. They have a bell now that they ring at that time. And all of the doctors and everything just ascended into his room.
Right.
And so you're right. It can cause death. And, I experienced that with him. So thank you for sharing that.
Well, and, talking about sepsis and septic shock helps survivors and their families, even people who have not survived, because, my friend Ann, who it talks about it at Congress and all of other places at that point, it was important for her to tell that story. If you read the book called In Shock, it's written by Rana, I can never say her name, but it's called In Shock. She's a doctor, but she ended up in her own hospital in sepsis. And she talks about the out-of-body experience. I've heard her speak several times, and she talks about the out-of-body experience. And it's funny because I've talked to lots of people who've survived sepsis in emergency rooms, and all of them talk about the out-of-body experience. But in 2015, I was doing a presentation for CMS and a webinar, and I was in our practice round, I was telling my story and about how these steps happened to me. And I said, it gets to the point where I have this out-of-body experience where I can see my body and I can see everybody in the room, but I can't communicate. I can't get anybody to understand that I am very, very sick. And they called the person who was sponsoring the webinar and said, she can't say out-of-body experience because that's religious. And 2 weeks later, I was at the IHI conference and was hearing the person who wrote In Shock, and she said out-of-body experience. And I'm like, it is. It's not a religious thing. It's a real thing that people experience, and it doesn't have anything to do with religion. It has to do with the fact that you can't communicate. And I mean, I would try to shake my head. I would try to do anything, and I couldn't get anybody to understand. And David was very aware when it would happen to me, because for me to be quiet is very unusual. Even when I'm in the hospital, for me to completely stop talking means there's something very seriously wrong. And, but it's important that if anybody's experienced septic shock, talk to them, let them talk about it, because the more I had patients talk about it, the more they felt like they had control. Because, if somebody goes into sepsis and the septic shock once, it can happen to them easier than someone who's never been septic. I have experienced 15 septic shocks in my life in the last 13 years. And in the beginning, I didn't even realize it was sepsis. I remember a night when I was discharged from the hospital. David was taking me out to the car with the wheelchair. And I got as far as the door and I'm like, David, I don't feel right. And I'm slurring my words. And David literally turns me around and takes me back to the floor where I came from. And they said, no, she's discharged. She's fine. And he goes, she's not fine. And they wouldn't readmit me. So then he turned around and went to outpatient clinic and said, you've seen Rosie when she's septic. She's going septic. And sure enough, I was. And basically, then I got readmitted. But I had to go. I mean, if David wouldn't have been with me, I would have died that night, because no one understood that I was having this experience. I have a sister-in-law, and some of you know her. Her name is Paula Bartel, and she's been on some of these calls. And she's lost her vision when she had a benign tumor removed from her optical nerve. And she was starting to get her vision back. And then she developed sepsis and infections and sepsis. And they sent her home twice. She was home less than 24 hours. and was back in the hospital in septic shock and nearly died both times because they sent her home not realizing she was experiencing sepsis. So, you know, families and patients have to talk about this, because before I started telling healthcare professionals what it was like, I remember going to conference and literally going to any workshop that was on sepsis and raising my hand and saying, do you talk to your patients? Do you ask them what it's like for them? And they would say, no, we don't ask our patients. They're too sick to tell us. But they aren't too sick a couple days later or a month later, and they're going to tell you that this is what they've experienced. And it's important. It's so important for survival, because the more you understand what's happening to a patient, the better you can treat that patient. And I believe the protocols today are because we started collecting stories. I was collecting stories. The person who wrote In Shock was collecting stories. You know, there were people across the country who started collecting stories from other septic shock patients. And we started telling our healthcare professionals, this is what's happening. This is how it happens for us. Any questions or any thoughts on this? Because if any of you, you know, I mean, I remember being young and hearing people say, yeah, she had pneumonia, she died, or she had cancer, but she died of pneumonia, or she died of sepsis. And I didn't know what sepsis was. And but today I know what it feels like, and I know what experience it is.
Hi, Rosie. Thank you for your story. So I'm a mom of a daughter who's now 18 that is on TPN and lipids and has been for the last 8 years. And as you can imagine, having a central line that is used every single day is terrifying.
Me too.
It's before she was born, we were fostering a baby. She died at 21 months. She had a shunt infection, went into the hospital, ended up on TPN and lipids, got a line infection on top of everything else, was all the way up to ECMO by the time the heparin just destroyed her brain.
Right.
ECMO. And so we let her go. We were able to adopt her and let her pass, because children in foster care are not allowed to, there's no disconnecting them from life support. And so we made that happen and we're able to let her go. But my daughter, who's 18 now, she's been on, it took many, many years to get a diagnosis. She has pseudoobstructive gastroparesis and will be on TPN and lipids the rest of her life. She has no ability to eat orally, or G-tube or J-tube or otherwise. And one of the amazing things with her, as you can imagine, after experiencing the death of a child who's septic, I was terrified when they put her Broviac in and she started on TPN and lipids. I can honestly tell you, she is like no one else. She has never in 8 years had a line infection. You know why? She's the only one that touches her line. She's the only one that accesses, deaccesses, and does her blood draws. The only thing that I do for her is change her dressing. And we've gone 8 years with not a single hint of a line infection. And her pediatric GI doctor holds her up, not by name, to the other families to encourage them to have their children start partaking in their care if they're capable and they have capacity to do it. And so, you know, really belief in, you know, how much a child can learn. Now I'm not saying that she'll always stay this way. God knows that I hope that it does, but I know the odds are more against us of her staying uninfected than they are for being clear. But for right now, she's building a strength, right? By not being on antibiotics all the time, by, you know, not having a line infection one after another, going into the operating room to replace the line, the whole thing. So thank you for your story, because for those of us that actually live it with a child, it's intense and scary at most times.
Right, Kathy, I live with I have a central line and have had the central line for 13 years because of the fact that, but I have never, they have yanked my central line multiple times because when I get sepsis, they think it's my central line, but it's never been my central line. They've always, it's not because I'm the same way. I give my own antibiotics. I give my own, yeah. I'm, you know, people say that all the time to me, and I mean, in the beginning, 13 years ago, I literally programmed you know, now antibiotics are easy to give, but in those days, I had an IV pole in my office at work and an IV pole at home, and I programmed it. I would talk to the pharmacist and say, you know, because I was on an antibiotic that had to be reprogrammed all the time, and I knew how to program
she's the only kid in our school district of, I don't know, we have like the fifth largest school district in the country because we're just one district and a couple hundred schools, and she's the only one going to school with an running IV line. She graduated last year, and it was shocking for most of her doctors to know that she was in school full time, but we put a lot of accommodations in place for her. I think the other thing too with sepsis is, you know, there's new medical technology. We used ethanol versus heparin for a long time. It keeps the line clean, you know, was able to do that. Then when ethanol went away, we now use a vancomycin lock. It has a little bit of antibiotic that goes in every single day for 6 hours. So I think there's new technologies out there and new medical things that help make this possible. I think it's our good technique, her good technique, but I think it's also the new medical availability for locking your line if you have to disconnect.
So, and yes, I'm happy that she's doesn't have problems with it, and I'm proud of her. I mean, it takes a lot to be self-sufficient like that. You're very, very proud of anyone who, I mean, people say it all the time to me, I can't believe you do your own antibiotics. I can't believe you do, you know, and I'm like, you know, I go in to have it accessed, and then, you know, basically from there I go. And for a long time, I had a different type of central line where it didn't have to be accessed. So I had a Gershant, which had 2 tubes off of it because I needed 2 different kinds of, and then I didn't need to have it accessed, and I could do everything myself. So, any other thoughts before we go to the final question or final thought?
Rosemary has her hand up.
Oh, hello, Rosie.
This is Nancy. I need to jump in, and I don't know how to do this with the phone thing. I just unmuted myself. My experience as a family member goes back 12 years, and my husband's first hospitalization was pneumonia. The next 3 were C. diff, which is an abbreviation for Clostridium difficile. And I'm quite sure that the #1 item on his death certificate said sepsis. So my bottom line is, if you're a smoker, quit, because he probably wouldn't have gotten the pneumonia had he not been a long time smoker. And as to the treatment, it seems to me every time we took him back for readmission, it was pain issues in the gut that were bothering him. Yeah, and I have no more input on that, but that's why I perked up and made sure I got here today, was to listen to all this.
Right. Well, and the pain issues probably were from the antibiotics. That's, you know, antibiotics really mess up your stomachs. Your stomach, it's just one of those things you have to deal with. But, you know, it's survive. Antibiotics can help you survive, but they also can mess with your whole immune system and especially your stomach. Any other thoughts? I can't see the hand, so I'm sorry, Laura.
No, that's okay. Rosemary.
Okay.
Thank you. So, Rosie, thank you so much for sharing your story. I really appreciate the personal experience of what it feels like. My youngest daughter, her first bout of sepsis was at 2 weeks old. And it was incredibly frightening, I think, from a parent's perspective, to watch your newborn go through the experience. But it was the healthcare providers that recognized it amazingly. because we'd all been sick with the norovirus and thought, oh, maybe she's sick too. And we'd taken her in for a different reason. She was born with a cleft palate. We were supposed to be meeting with the plastic surgeon to talk about a repair at about 4 to 6 months. And he took one look at her and wouldn't talk to us. And I remember thinking how very rude this physician was, that he wouldn't talk to us about what his plan was going to be for this child. And they ended up sending us directly to the ER. And if he hadn't done that, she wouldn't have lived. Like, she only had hours. And so it is an awareness of the providers. And this provider happened to work with, I can't remember the name, that Smile agency that goes all over the world and corrects clefts. And so he was aware of what it looked like immediately. And us as parents, and even as a provider myself, I didn't recognize it in my own child. I think you're so sleep deprived and everything else, and having also been ill. And it was interesting because she never ran a fever, and they just couldn't understand how a newborn would be septic and she didn't have a fever. And it was interesting that you don't run a fever either. So there's certain aspects of it that we can't always count on as providers to see, but that we need to really recognize and listen to the families and what they're saying is going on with their loved one, so that we can understand that whole total aspect. So I just really appreciate that insight. Thank you.
I agree, Rosemary. Sometimes it's the family. I mean, I don't believe I would be here today if it wouldn't have been for David on several occasions where he just, said, there's something wrong. This is not normal. This is not the way she acts. This is not, and yet I didn't have a temperature. So, basically I can have a full blown infection and I don't have a temperature, and it's just who I am. And so the temperature is not and they
rely on that because, I mean, my daughter, she's 8, she's been septic repeatedly.
Once you are,
and we have it in her chart that she is septic with a low temp, because they won't acknowledge it otherwise. And they don't want to do those blood draws because, well, we might get a false reading. It's like, just believe me when I tell you, this is what it looks like. Yeah.
And what's interesting is that, the low temp, that's why my infectious disease doctor said the protocol for Rosie is when she hits 100, she's already in septic shock. So like she would say to David, if her temperature is at 100, call an ambulance, but when I've been flighted, I've been flighted from a 21 bed access hospital that was 2 blocks from my house to my regular hospital because there wasn't enough time to get me there by ambulance. And so, that's how serious sepsis is. Because, and when they put me on that flight, the people in that 21 bed access hospital kept looking for my obituary. They did not believe I was going to survive the flight. And yet I'm here today talking about it because, people like David, I mean, even when I got to my regular hospital, David came to the emergency room and he looked at me and he said, she's in septic shock because she's not responding to me. And so he went to the head nurse and said, she's in septic shock. You need to do something now. And so then they intubated me and I was in a coma for 6 days. But, if they hadn't intubated me at that point and started treating me for sepsis or septic shock, I wouldn't be here today. But it's family members need to be aware of what's going on with their family. I mean, my biggest fear these days is the fact that I live alone and I'm a little stubborn and I don't always call the doctor when I feel that fuzzy brain. And that's when I need to call the doctor, is when I have the fuzzy brain. And if I don't do that, if I feel like I'm just bothering him, then I could end up in septic shock and my children would find me dead in my house because, but when you live alone, I lost David 2 years ago and I lost my my lifeline sometimes, I think, you know, because I'm not as quick to jump on things as he was. We have about 15 minutes left, so I don't know if we want to go on to the third thought of the day, or
we can go on the last one here.
And I've kind of been talking about this. Yeah. It was patient stories and experiences that led new protocols for sepsis in emergency rooms and for first responders. I can tell you that 13 years ago, they drew my blood first, and then they decided I was septic. And that's how Anne's daughter died, because they never drew her blood. They never took a blood. You know, she went to the emergency room. They said, oh, it's just the flu, and sent her home. And so they never drew her blood. They never gave her an antibiotic. And it's the fluids are just as important as the antibiotic, because your body is literally, and you know, sepsis does things like it destroys your kidneys. It destroys other organs. It's not just that one time, but you know, you have kidney destruction because of it. Then some of the antibiotics you get destroy other things in your body. So, you know, but telling your story about any illness is important, because that data helps people understand and helps the healthcare profession. When we talk about co-design and being partners, that's the partnership. They might know everything about medicine, but we know everything about our bodies. And we are the people that have to talk up and say, this is still going, I know, this is what's going wrong. And parents, you know, as I've studied it, newborns from under the age of 1 are as susceptible to sepsis as someone that's over 65. Kind of the same susceptibility is pretty much the same. But it's us telling the stories, and that is data. That is as important a data as all the other data that they collect in this world. Your story is more knowledge than they sometimes have about an illness. So don't be afraid to tell your stories. Tell them over and over and over till somebody, you know, and collect other people's stories. You know, I would ask, you know, if somebody said they were septic, I'm like, and what was it like for you? I mean, I always was asking people, what did it feel like? How did you know? And, you know, basically, you know, there's a book that a doctor, an emergency room doctor wrote in Wisconsin, and every person in that book talks about the out-of-body experience. So they're all people that nearly died, and they talk about the out-of-body experience.
Tara, excuse me, Tara has her hand up.
Hi, I just want to introduce myself a little bit. I'm here because my 16-year-old daughter passed away from acute sepsis in 2017. She was normal, happy, healthy, ridiculously annoying 16-year-old girl. And she developed a sore throat, and it progressed very quickly. And within 3 days, she was at the ER, and the hospital worked really, really hard at trying to reverse it. They were very, very good in their knowledge with sepsis, but I still work very closely with them and with a lot of community groups and events to, you know, just to be active about it and to raise an awareness. And one of the things that's striking me about this whole meeting is Gianna did not have much of a temp. She had a little bit, it fluctuated a little bit, but over the 2 days or so, she really didn't have that high temp that everybody says to watch for. And I tell everybody that, and I tell everybody that all the time. That is a warning sign, but that is not the warning sign. That is not what you can go off of, because she never, even by the time she got to the ED and was so sick, her temp really never went up. So it's striking to me that there's so much talk about that here in this meeting, because I'm actually glad to hear it. So I can continue to raise my voice about it.
I'm sorry for your loss, Tara, and that's one of the reasons I want to make that point, because many times, many of the sepsis patients, families, I've talked to a lot of survived patients or families where they didn't survive, and that was why, especially of young people, because they think that it's not sepsis because they don't have a temperature. And they don't have a high temp, and that's, you know, and they look for that, and it's not the, I say the fuzzy brain and not being able to communicate and not being able to, you know, start slurring your words, you know, it's remember, it's infection in your blood, and it's attacking everything in your body, so it's attacking your brain. And so that's why you start getting this fuzzy brain, and that's why you're having trouble making, you know, talking and making sense. I mean, David would say, Rosa, you're not making sense. You're going sepsis. And I'm like, no, I'm not. I'm just having a bad morning. But he was always right, because it is that fuzzy brain and not being able to get your words out. And those are the first signs before there's any temperature. And even survivors will tell you that before they had the temperature, they had the fuzzy brain. And, you know, for children, that's hard for them to explain. And for children, you don't always see that. And especially infants, you know, it's really hard to understand that your baby isn't doing well.
Yeah, that was one of the things with Jana. She up until she was conscious and pretty aware up until the time in which they had to intubate her. In one of the things, and to this day, I'm very close with her doctor. Well, she had many doctors, but one of her main doctors, she could not pinpoint what was wrong. She couldn't say, it's this. She couldn't point to anything. It was an overall, I don't know, something's wrong. I just don't feel right. And to this day, her doctor says that is one of the things that, especially with children, if you can't point to something, or if you can't ask them, get them to answer a specific question about where does it hurt, that's a key element. And she, you know, she was 16, she was perfectly able to describe any part on her body that could have hurt or any reason why, and she couldn't.
My 8-year-old would do the same thing and say, I don't know, I just don't feel good. I just don't feel good. Help me. And it's like, yeah, and it's so difficult because there is nothing to explain it.
And that's so true. That the woman, Ann's daughter, that was what happened. Every time she went to the emergency room, they wanted to know what hurt, and she couldn't say, but she knew she was sick. And you know, the morning of the day when I ended up being flighted later in that day, that morning when I got up, and I'd had a major surgery, you know, I'd been home from the hospital about 5 days, and the next day I was supposed to see my surgeon. So I said to my husband, I said, I'm not feeling quite right this morning. And this was before I started slurring my words or anything. I said, but I think I'm going to pack a bag because I think I might end up staying. And then by 4 o'clock, I was so bad. And then I was hemorrhaging because I have MRSA, and MRSA literally ate through an artery. And so I was hemorrhaging. And so basically by the time I got to that first emergency room, my blood pressure was 65/45. And that's why they didn't, and they knew I was septic, and they knew, you know, they were trying to I had 19 units of blood that night and surgery. And I survived it, but it was only because everybody, and I believe I would have died in the second emergency room if David wouldn't have said, you need to do something now. You need to do something right this minute because she's in septic shock.
Thank you, Rosie. Libby has her hand up, and then we have an engagement opportunity to share with you all. So Libby will be the last one.
So, hi everyone, and Tara, I'm very sorry for your loss, and Rosie, I appreciate you coming. I think one of the reasons we wanted to have, you're welcome. Yeah, my heart's broken for you, but yeah. I think that one of the reasons we wanted to have this conversation, as difficult as it is to understand the patient perspective, of course, and really raise patient family voices as a network. And this is our safe space, right? This is our 1 hour out of all the other work we do to come together as peers, as patient family partners, and really just speak our truth. So I really appreciate the vulnerability with which you've all done that. I will remind us all that lessons leave and stories stay. And I think that we can all take lessons from what we've heard today. But what I'm really interested in is, how do we amplify what you all have shared today? And so I will just make this offer of follow-up that potentially, because we work in CMS quality improvement programs and all of them have a focus on sepsis, perhaps what we could consider doing is a recorded interview with all of you to share your perspectives, because as we've heard today, this is what we want to do, is really mobilize the patient and family caregiver community to, one, recognize sepsis in their own loved ones. Secondly, be empowered to speak up about that to healthcare providers. And then thirdly, as a community of the PFA network, how do we have the opportunity to change systems, much in the way that Rosie's been talking about, like how do we raise this awareness of the patient experience of sepsis as a critical indicator of identifying sepsis? And so I think what I'd like to suggest is that we might follow up with those of you who have shared today and anyone else on the call who has experiences they might like to share, and just do a quick video put together that we can then share with the 314 hospitals that we're working with in the HQuick program, and the 7 states we're working in quality improvement in. And so I would, if you're all amenable, I'd like to suggest that.
I'm right there with you, Libby, because I started out with a hospital association. That's where I started asking them to talk to your patients, to ask them questions, because, and I understand that when it's happening, they're in the mode of taking care of the problem.
Right.
But when it's over, finding out what led up to it is going to help prevent it.
Exactly. All right. Well,
like, I know Rosemary's Game.
Yeah. All right. Well, I will follow up with you all, and we can move on. All right, Laura, you want to? Thank you.
Yes, thank you. And thank you, Rosie, Tara, Kathy, Rosemary, everyone who shared today.
Yes, thank you for sharing. I'm glad you came. And Tara, I hope you join us again.
Yes.
Welcome to the group.
I would like to stay along for this ride. It's nice to be able to share and hear some other people that have gone through this or are still going through it. And I need a safe space once in a while.
Yes.
Right. Definitely do, Tara. Definitely.
Thanks all. Thank you all very much.
Thank you.
Bye-bye.
All right. Oh, I made this one. There we go. So this is our newest engagement opportunity we have for you all. CMS is the CMS Innovation Center is holding a webinar next week. Yeah, in just a few days on September 20th. And they'll be talking about the approach to testing models and the innovation center that support person-centered care. So they'll be talking about how the innovation center model tests incorporate patient perspectives across the models in order to improve, to ensure patient needs are met. They'll also be talking about how their strategy refresh is building a more person-centered health system. So they are inviting everyone to join, and I'm going to put the registration in the chat right now.
And while Laura does that, I will just let you all know that the coordinator at CMS for this meeting reached out to us specifically to invite PFA network members. So just wanted to add that on, that, you know, as the community grows and strengthens, we are being recognized as an asset to CMS.
And I had gotten an email yesterday from them too.
Oh, nice.
This is Nancy. Since I can't see chat today, could that information be sent out by email, please?
Yes, I will send out a follow-up this afternoon with that. And it's also in our forums. I posted that there, and I'm going to add that in the chat, but I'll also add that in follow-up just with some more information, and the registration link is in there as well. So you are
Thank you.
More than welcome to head over to our website, to the forums, and check that out. So that is our engagement opportunity. Any questions about that or comments before we close out today?
I'll just add that there's a lot of prep material available just to get context before you join that meeting that I would recommend. And again, that's on forms as well.
Yep. Thank you. All right. Well, thanks for joining us, everybody. We are at 10 o'clock, well, 10 o'clock Pacific time. Thanks for joining, and we'll see you all next month.
All right, take care.
Have a great weekend.
Thank you, everyone. Thank you for letting me share my story.
Thanks for sharing.